is Dr. Deepa Mahananda, and I'm here with Dr. Alex Petruszewski. We're the directors of Sydney Low Carb Specialists, which is located in Castle Hill in Sydney. And we are putting together this presentation about how we can eat to enhance our well-being, and also what kind of low carb diet might be right for you. So this is really a way for us to present some information about what low carb nutrition is and how we apply it. Sydney Low Carb Specialists is a group of GPs, a dietitian, health coach and exercise physiologist, and we all have a personal and professional interest in a low carb way of eating. We're running this specialty clinic in Castle Hill, and it's been open since 2019, and we use an integrative and holistic medical approach to our treatment of a variety of health conditions, as well as just also for the purposes of optimising good health, of which we all deserve. And in this time, we've treated more than 2,000 patients.
Practicing in Sydney, we understand that accessing high quality, low carbohydrate clinical care can be hard for people that live in rural and regional areas. And so for that reason, this October, we are doing our second outreach clinic out to central New South Wales. So on Friday, the 18th of October, we'll be providing clinical care in Bathurst at We Care Bathurst. On Monday, the 21st of October, we will be in Orange at Central West Neurology and Neurosurgery, offering clinical appointments there. And then we will be finishing up in Dubbo on the 24th of October and the 25th of October in Dubbo Medical and Allied Health Group and at Dubbo Specialist and Rehabilitation Centre, respectively.
To kick off the presentation, I wanted to look at something that many people are quite familiar with, which is the food pyramid. And this is what the Australian dietary guidelines have been based upon for at least the best part of the last 50 to 60 years. Unfortunately, this pyramid has evolved over time to demonize saturated fat, which can actually be quite healthy for our bodies. And it also has quite a large emphasis on servings of non-essential grains per day. So sometimes upwards of 7, 8 and 9 serves are recommended depending on the person, their gender, the level of activity. And then the focus on vegetables and fruits down the bottom, which whilst at face value this looks great, there isn't any distinguishing between the different vegetables and fruits and their carbohydrate content, which can actually greatly affect blood sugar depending upon the type of vegetable or fruit that's eaten and the quantity of it as well. Lastly, these guidelines actually apply to a generally healthy population, and this is actually written into the fine print of the dietary guidelines. So in other words, if you don't have any medical problems and have no diagnoses with a chronic medical condition, then you may be actually able to follow the healthy food eating pyramid without consequence. However, it doesn't tend to work well for people who already have a chronic health condition, and in those settings, we need to actually apply other avenues of treatment and other avenues with their nutrition as well. It needs to be tailored to the individual. So we really need to question, are we a healthy population when the rates of dementia, ischemic heart disease, cancer, diabetes, and even stroke are increasing in our community? Well, these are the leading causes of death in 2023 at the last lot of data that was collected on the leading causes. And these actually have a common underlying thread. We need to emphasize that insulin resistance is now a recognized underlying factor in all of these conditions. The hormone insulin is something produced by our pancreatic gland, and in the modern Western diet, where we eat upwards of 300 grams of carbohydrates per day, it means that our pancreas may need to go into overdrive for quite some time of the day to account for this level of carbohydrate that has been eaten, because carbohydrates, no matter if they're savory or sweet, need to actually be broken down into chains of sugars, or in other words, glucose, in our body. And the hormone that's responsible for being able to take this glucose into our cells or into our fat cells and into our muscle cells is insulin. So eating a high carbohydrate diet actually leads to, over time, a high insulin state. High insulin levels means that insulin resistance is the next consequence. And this can actually also cause great problems with blood vessel inflammation, which can lead to heart disease and stroke. It can be quite appetite stimulating, so people can often report feeling like they need to eat all the time and they're feeling hungry, and also lead to fat storage, which is commonly noticed as weight gain over time, but also finding that it's actually more difficult to lose weight where other strategies had worked previously before. Insulin resistance doesn't tend to occur just overnight. It actually happens over a number of years, and it happens well before someone is actually diagnosed with type 2 diabetes. So what goes on is that our pancreas will secrete insulin over time, which is shown here with the blue line, and the bottom axis is really looking at over a number of years. I'm now going to overlay the red line, which is actually someone's blood sugar and what's happening in response to the insulin. So initially, for that first 1 to 8 or 9 years, this person has had a fairly well controlled blood sugar. It hasn't really changed very much. However, the insulin levels have continued to creep up over time. And then what eventuates is a transition point here. And this is where the green arrow is pointing to, where the blood sugar levels are starting to escalate, but the insulin is no longer continuing to rise. Now, this point is where we start to see pre-diabetes beginning, and the crossover point at the top, where the blood sugar level is really escalating, is when we have gotten into a period with diabetes and then having pancreatic exhaustion. So the pancreas is now failing to produce enough insulin to take care of the elevated levels of blood sugar in the bloodstream. A key component to understanding the benefits of low-carb nutrition is also understanding the impact of what a carbohydrate, a protein, and a fat does to our blood sugar. And all foods can be broken down largely into one of these three components, often a combination of these as well within certain foods. So we know that carbohydrates can cause the highest insulin and blood sugar response. We also know that proteins to an extent can cause an increase in our blood sugar and insulin levels, but nowhere near as high as carbohydrates. And fats actually have the least or the most inert response on insulin and blood sugar levels. And this is why a higher fat approach and a very low carbohydrate approach can better regulate our insulin and blood sugar levels. Which brings me to what is low carb. In research studies that are published, the low carb diet is often referred to anything that's under 130 grams of carbohydrates per day. However, this is very poorly standardized in many studies, and sometimes studies will quote a diet as being low carb if it is any lower carb than the 7 serves of grains that are suggested in our dietary guidelines, which is quite high. And this makes comparing studies done on low carb diets quite difficult because it's almost like comparing pears with apples. Not all low carb diets will result in a state that we call nutritional ketosis. And it's important to recognize that low carb is actually a spectrum. We can have the ketogenic version of a low carb diet, which is quite a low level of carbohydrate intake, typically less than 20 to 30 grams of carbohydrate per day. Then there's the moderate low carb intake, which is somewhere between 20 to 50 grams of carbohydrate per day. And then there's more liberal low carb approaches, which are between 50 to 100 grams of carbohydrate per day. How we decide which one fits you is based on your level of metabolic health And part of that is understanding whether or not there is any form of insulin resistance going on, and if there is, how far progressed that is. The more progressed the insulin resistance, the more a very low carb approach is going to be more effective. Which brings me to explain further the ketogenic diet, which is the very low carb dietary approach. Typically, there would still be quite a good or decent amount of protein, very similar to what a person may have already been eating, and sometimes that can be increased as well. But it is classically a very high fat comparative diet to the carbohydrates and proteins that are involved. And you can see here that in your traditional ketogenic dietary approach, that fat can actually approach upwards of 70% of the food that is taken into the body. But we just want a ketogenic diet to be low enough in carbohydrates that the fat that's stored in your body and the fat that's eaten from food is used primarily for energy in the form of ketones. This is a powerful thing that our bodies can do, and that is making our own ketones. And we have that beautiful capacity to do this through our liver. So when we're eating very low carb, which means that we have a low glucose state in our bloodstream and also low insulin levels, our fat tissue or the adipose tissue is able to release stored energy that gets sent to the liver and formed into these products called ketones. We can also get some of these building blocks for the ketones from our dietary fat as well. So it's really the combination of the fat stored on your body and the fat that you eat that go through to the liver, and the liver synthesizes long chain fatty acids together to make ketones. And this is why ketosis or nutritional ketosis or even the keto diet gets its name, because classically it's being able to switch your body from being a sugar burning body to a fat burning body. A discussion about dietary approaches isn't complete without addressing the long held myth about calories. So often people would talk about simply the premise of calories in being equal to calories out, and that is the best way to manage body composition. However, there is far more to the story. A calorie of a Mars bar doesn't have the same hormonal impact or the same nutrient density as a calorie of an avocado. In fact, if we were to compare the two and you were to have exactly the same amount in grams of each food, you would find that your blood sugar would rise quite rapidly and quickly with the Mars bar. But if eating the same quantity, so this 53 grams of avocado, you would get no rise whatsoever in your blood sugar and therefore also no insulin rise. And this is a very powerful chemical effect that occurs within the body. So the whole idea of calories out, where the diet is somehow going to be outrun through our exercise, is ignoring the fact that calories actually are not all the same. And in fact, our dietary approach is more the fundamental way that we need to understand how to regulate the insulin level, more so than the impact of exercise. So it's not just satisfactory for us to recommend eating less and then telling someone to move more. To address underlying insulin resistance, we have to do a lot more than that and address the hormone changes that are happening within the body, particularly with the hormone insulin. Now, fasting is another tool that we can add in, and we do regularly counsel and coach our patients with different types of fasting methods. And broadly, these are all come under an umbrella called time-restricted eating. So in this, you might see some familiar types of fasting, such as the 16-8 approach, where people fast for 16 hours and they have an 8-hour eating window. So fundamentally, It's really the difference between a fed state and a fasted state. And whilst partially there is a relationship to calories, the more powerful consequences is the regulation around blood sugars and insulin, the hormone insulin, as well as being in a setting of being able to burn sugars and also being able to burn fat in a fasted state. Now, ketogenic diets can also be quite powerful beyond insulin in that they can reduce gut inflammation. And in our modern society, or the westernized society, we've got an increasing problem with leaky gut, also known as intestinal permeability. And it is well known that through the anti-inflammatory effects of a ketogenic diet, that the gut microbiome and the gut wall as well can actually heal over time. We also encourage people to be aware of the types of fats that they are consuming. So seed oils basically took over from saturated fats because it was mistakenly thought that it was the saturated fats that was causing the increased incidence of heart disease. But in fact, the problem with seed oils is that they are quite high in omega-6 comparative to omega-3. And what happens is that this relationship between omega-3 and omega-6 should typically be 1:1 on a standard dietary approach. But in our modern dietary approach and people eating the standard dietary approach, this could be upwards of 1:30. Where the omega-6 is quite high relative to the omega-3. And largely this is because of the excessive consumption of seed oils. So I really would like to bust that myth about will eating fat actually make someone fat, and also will it cause heart disease? The short answer to both of those is no. And there's been a number of studies done on this and books written about how the old hypothesis about eating fat has actually been debunked. One study that I'd just like to highlight is an analysis of all of the studies to date that have explored saturated fat and its impact on heart disease and diabetes. And what this group found when they reviewed the totality of the evidence is that there is no increased heart disease risk or diabetes risk when people consume whole fat dairy, unprocessed red meat, and even something like dark chocolate, because these foods in their whole food capacity are actually within what they call is a normal food matrix, with high saturated fat content, but also high in other nutrients and non-nutritive components. So the new recommendations should really emphasize food-based strategies that translate to the public, that are understandable, but also reflect this information, this more accurate information, that saturated fat does not need to be restricted to reduce the risk of heart disease. So what can you eat on a low-carb dietary approach? Well, you've got quite a lot of choice, and this is just a beginning of that to illustrate it. So the numbers on this pictorial here basically represent the number of carbs in these foods per 100 grams. So for instance, if you had 100 grams of cheese, you would be getting about 1 gram of carbohydrate. So all of these foods here in the picture are very low carb foods. You could eat as much as you like and really find that you do not exceed a carbohydrate intake of 20 to 30 grams of carbohydrates per day with this approach. To illustrate the difference between vegetables, those vegetables that grow above the ground are our lower carbohydrate vegetables, and there usually is no need to restrict their intake. You can eat them till you feel full and paired with other proteins and healthy fats. And then the vegetables that grow below the ground are the ones that contain our higher amounts of carbohydrates. And we generally seek to reduce the volume of these, or even to stop eating them altogether, depending on what the reason is we're using the low carb dietary approach for. There is also a difference between fruits, and generally speaking, the berries are the lowest form of carbohydrates, or lowest carbohydrate in fruit. And in terms of the other fruits, they all tend to be much higher. The same goes with nuts. There is also a bit of a distribution. Our lower carbohydrate nuts are the pecans, macadamias, and Brazil nuts, with the higher ones being cashews and pistachios, which not unsurprisingly are quite difficult to stop eating. And I think that partly is explained by the high glucose and high insulin that occurs when you begin to eat it. And you might recall earlier in the talk, I mentioned that when your insulin levels are high, it can lead to overeating and not ever feeling full. And in bringing this all together, people can still enjoy very delicious meals that are able to be had not only individually, but also within a family setting. So meaning that families can actually create one meal and make slight variations to cater for the different carbohydrate tolerances that each individual within that family may have. So for example, these are some illustrations of typical breakfasts, lunches and dinners that a person following a low carbohydrate dietary approach might choose. Then there are also ways to replicate foods that people might enjoy but miss on a low carb diet, such as burgers or pizzas and sweet treats. So these are just some examples of how these can be quite easily achieved with some different modifications in terms of the ingredients used, and perhaps replacing a bun with lettuce or even a low carb bun to emulate a burger. And as for food on the go or food that can be served for family meals, these are also some examples of that. Lastly, I wanted to emphasize that the food which you may see in the health food aisle is usually actually not healthy. I'd probably say only about 5% of the foods in that aisle are. And I think it's just important to turn over the product and actually carefully read the ingredients and the nutritional label. Two of the common problems with these foods are that much of the sugar is replaced with a lot of artificial sweetener that is often a type of sweetener that it can still be disruptive to the gastrointestinal tract and also cause blood sugar and insulin disturbances. And the second problem is that there are often ingredients that we would not suggest are ideal for the body because they can lead to inflammation, such as seed oils, emulsifiers, additives, and other flavors and coloring as well. So just a buyer beware warning, I suppose, when it comes to changing to a low carbohydrate dietary lifestyle. It's important to recognize which foods are actually made from quality and helpful ingredients rather than most of the ultra processed keto, so-called keto and low carb food, which can actually be quite damaging rather than being beneficial to health. I'm now going to hand over to Alex to talk about the applications of using a low carbohydrate dietary approach on different medical conditions that we see in our practice.
So if we look at the potential uses of low carb medicine, we will quickly see that there are many diseases and processes that can benefit from a low carbohydrate way of eating. In our clinic, probably the most common use of this type of medicine would be for weight loss. So patients will come in for weight loss, and consistently low carb diets have been shown to be superior to other dietary approaches when it comes to losing weight and maintaining that weight loss. Similarly, the management of diabetes, both type 2 and type 1, is something we do a lot in our clinic. So we see a lot of patients for reversal of type 2 diabetes or putting type 2 diabetes into remission. Polycystic ovarian syndrome, endometriosis, and also potentially improving fertility is an increasing part of our practice, and we will also see women to help them through their pregnancy journey once they are pregnant. Fatty liver disease is very commonly associated with insulin resistance and metabolic syndrome, and so that commonly reverses on a low carbohydrate approach. We also see patients for management of joint issues, so primarily osteoarthritis and also inflammatory arthritis and other autoimmune conditions are becoming an increasingly common part of our clinical practice. There are some other uses as well. So if we look at gastrointestinal disorders, low carbohydrate approaches can help with gastroesophageal reflux. They can help with food intolerances such as IBS and celiac disease. They can also potentially help with inflammatory bowel disease such as Crohn's and ulcerative colitis. If we look at mental health, this is a very active area of research, and we will see patients for the management of depression and other mood disorders as well as chronic pain. Menopause is an increasingly acknowledged area of medicine where women have been underserved, and in actual fact, a metabolic approach can help manage some of the symptoms of menopause. And finally, if we look at neurological disorders, this is another very active area of research, especially with ketogenic diets. So patients with dementia, such as Alzheimer's disease, patients with Parkinson's disease, patients with recurrent migraines, and especially patients with recurrent seizures and epilepsy, they are commonly found to improve on a low carbohydrate approach. And finally, the last group of patients that we will see is the patient who is not sick or does not have any problems now, but is well and healthy and looking to optimize their health and performance and also increase their longevity as they age. So this is an area that's quite emerging for us as well in our clinic. So to help us with our assessment of each new patient that sees us, we will often order some tests. We typically order quite comprehensive blood tests for patients that first see us who haven't had them done already, and we tailor that to each patient's individual needs. Where patients need imaging tests, we will order those. So most commonly, we will order coronary calcium scores to evaluate for heart disease and plaque in patients, and abdominal ultrasounds for patients with gastrointestinal issues. And for the rarer patient, we will sometimes order functional pathology testing, such as microbiome testing or more complex food allergy testing to help us determine the best way forward. And on that note, just to harness the power of technology, we will commonly use continuous glucose monitors for our patients to help them determine how their body's reacting to the sugar in food and to help individualize their dietary approach. So this is an example of a patient who is wearing a continuous glucose monitor, which is a device sitting on the arm that measures their sugar basically every second of the day. And you can see here the trace of their blood sugar on a standard diet show that their blood sugars were going up and down quite dramatically on that standard diet. And when we switch them to a low carbohydrate diet, that same blood sugar trace looks much more stable, and this patient actually reported feeling more stable and less anxious on this approach as well. Now, before you change your diet, you do need to figure out why you're going to change it. In other words, you need to find your why. And this is going to really be determined by what is good for you and what your goal is. So why are you needing to change your diet? What is the problem you're trying to address? And how are you going to be able to do that in a way that's sustainable for you? And so although there are different approaches to low carb diets, there are some commonalities amongst all of them. So regardless of which low carb approach you opt for, you will be limiting processed foods and processed sugars. We will be avoiding seed oils, and we're typically going to avoid snacking for most patients because most patients on a low carb diet approach don't need to snack all the time. We also want to be focusing on nutrient density and making sure we're getting all those vitamins and minerals in that we need. Most patients on low carb diets do need to have more diligent attention to electrolytes, particularly sodium, magnesium, and for the carnivore patients, potassium can be important as well. And so we'll typically get patients to eat more salt and maybe even supplement some magnesium as well. So to start off, the most liberal approach we would describe is a liberal low carb diet, and in our clinic typically that would mean that patients would be eating between 50 and 100 grams of carbohydrates a day. So they would be avoiding those processed sugars and foods and seed oils and grains, but they may have some fruit and some starchy vegetables and nuts and seeds. So they will have some carbohydrates coming from these food sources. And so for the patient who might start out with a liberal low carb diet, might be someone who's not looking to lose weight but just trying to maintain their weight, or maybe someone who's only got a few kilograms to lose. Someone who's very active and is doing regular exercise and not wanting to jeopardize their short-term performance might opt for this approach, as might someone who's pregnant or planning pregnancy, although in this group of women there are potentially other options that are viable. And finally, as a starting point, this may be appropriate for someone who's feeling overwhelmed by the other options and doesn't want to jump into a more strict approach. A moderate low-carb diet is a little bit stricter than that. So in this approach, we would probably be taking out the starchy vegetables, but still having liberal use of above-ground vegetables, berries for fruit if needed, and then we're still going to be getting most of our protein from meat, fish, eggs, dairy, and nuts. Now, a ketogenic diet is a little bit different in that it's a very low-carb diet. And typically with this approach, we're getting moderate protein or an adequate protein intake, although sometimes we can bump it up a little bit higher. But typically we're getting a higher fat content. And the idea behind the ketogenic diet is that the carbohydrate intake is low enough so that fat stored in the body and fat from the food that we're eating is used primarily as energy in the form of ketones. And this process is what's described as nutritional ketosis. So if we look at nutritional ketosis, what's really going on is if we've got low glucose and therefore low insulin levels in our blood, then our fat cell is going to let go of some fatty acids it's got stored, and those fatty acids are going to go to the liver, and the liver is going to then break them down into smaller pieces of energy called ketones, which we will use for our fuel source. Now, at the same time, dietary fat can also be used by the liver in this way. And these ketones really have potential advantages over running on sugar in the body. So if we're running on ketones, they tend to be anti-inflammatory. They have some potential anti-cancer properties. So they've got lots of other side benefits in the body, and a lot of patients will feel better in this state of nutritional ketosis. So one variant of a ketogenic diet is what's described as the well-formulated ketogenic diet. And this is more of a modern approach to the ketogenic diet. But basically, the carbs are low enough to produce this sustained nutritional ketosis. So normally you're looking at between 20 and 30 grams of carbohydrates per day. And a moderate protein intake, which varies depending on how active someone is, but generally between 1.2 and 2 grams of protein per kilogram per day. And often we're not restricting protein on this approach at all. And we're eating fat to satiety, in other words, until we're full. And so this approach can be used for quite a variety of different things, but we would typically favour this approach for patients who have a lot of weight to lose. Patients with type 2 diabetes who are looking for reversal or remission, we will start here, and often even type 1 diabetics who want to really optimise their blood sugar control, we will push for this more strict approach. Patients with fatty liver who want to reverse it, and also the mental health patients, so such as bipolar disorder, depression, anxiety, schizophrenia. Usually you're looking for a ketogenic approach because those ketones, as I mentioned, they are quite potent when they're absorbed into the brain. Similarly, for other brain disorders such as the neurological conditions that I've mentioned before, we usually would like the ketogenic approach. Ketones have beneficial effects in the joints, so for patients with troublesome arthritis, that tends to be the preferred approach. And also for those patients who are looking for longevity or optimal health, the ketogenic diet offers many potential benefits in that the protein is not restricted, we're usually eating a high nutrient dense diet, and also there are anti-inflammatory properties that come from the ketones. Now this is in contrast to the traditional ketogenic diet, which has been around for many years. This diet's a little bit different in that it's a very low carb diet, but also limiting protein to some extent. So really the emphasis is on very large fat intakes with this approach. Often the ratio between fat and protein will be about 3:1. And so unlike many of the other diets I've mentioned up until now, the traditional ketogenic diet, the high levels of ketones in the blood, that is the goal. So you're actually looking for very high levels of ketones, which is why it needs that really high fat content. And very recently, Charlie Foundation and Johns Hopkins Medicine Hospital in America actually celebrated a century of using the traditional ketogenic diet as a therapy for epilepsy. So this is to show that this is not a new approach, this is not a fad diet, this is a serious medical therapy that's been around for some time with proven effectiveness and proven safety. And that traditional approach is now being used more and more for other neurological diseases such as dementia and Parkinson's, as well as for the treatment potentially of cancer as well. And it's a very active area of research at the moment. A slight variant of a low-carb diet that we're using more and more in our clinic now is the autoimmune protocol, or AIP diet. Now this diet is specifically designed for autoimmune conditions, and the aim is basically avoidance of common food triggers that can provoke autoimmunity in susceptible patients. So when you look at the foods eliminated, they also eliminate grains, refined processed sugars and food additives. But also this diet eschews the legumes, nightshades, coffee, alcohol, nuts, seeds, and many different oils. And also actually avoids dairy and eggs because of their potential allergenic effects. So this diet's a little bit different from many of the other low carb diets we've spoken about today. So the focus of this diet is really around meat, poultry, seafood in most people, healthy fats, fruits, and non-nightshade vegetables and herbs. As a replacement for dairy, most patients can have coconut products as well, and depending on their needs, honey is something that can be used, but it depends on whether that person needs to lose weight or whether they're diabetic and other factors like that. So some of the conditions we will use the AIP diet for include Hashimoto's thyroiditis, which is the most common form of thyroid problem, Graves' disease, which is another thyroid disorder, inflammatory arthritis conditions such as rheumatoid arthritis or ankylosing spondylitis or seronegative arthritis, inflammatory bowel disease such as Crohn's and ulcerative colitis, as well as some other autoimmune diseases such as multiple sclerosis and lupus. So quite a wide variety of different diseases we can use this for. The more strict approach when it comes to the AIP type diets is actually the carnivore diet, which many people may have heard of. And as the name implies, this is a diet that's basically avoiding all plant foods and is really looking at just the animal-based foods. And so this is something we will use in our clinic for patients where, for instance, they've got autoimmune disease and the AIP hasn't worked, so they need to get a stricter diet. We will use this as a gut reset or a gut healing protocol as well for patients who've got chronic IBS or significant fiber intolerance or small intestinal bacterial overgrowth. And we will also use this potentially as a strict regimen for patients with inflammatory bowel disease as well. There is emerging evidence that carnivore diets can also be helpful for the management of food addiction for certain patients as well, and we've had success on that front as well. And again, some patients who are looking for optimal health and well-being just feel better on a carnivore approach for whatever reason. So for some of those patients, they just prefer to be on that animal heavy diet. And so for this diet, you're really looking at meats, fats, eggs potentially, or dairy depending on that person's needs, as well as bone broth for drinks. And some patients, depending on what their version of a carnivore diet includes, may actually have some herbs or coffee and spices depending on what their needs are as well. A slight variation of the carnivore diet is the animal-based diet, and that's more of a newer phenomenon, often promoted by health influencers online. That is basically a carnivore diet, so the meat, fat, organs and salt, but also adding in some honey and fruits and sometimes even dairy. And this approach is for patients who've got a bit more flexibility, who would like to have some foods but are still looking to avoid the plant toxins that may make them feel unwell. And this is also trying to mimic, to a degree, some of what our hunter-gatherer diet may have looked like in the past as well. In terms of optimal athletic performance or sports performance, the right diet could actually be potentially any of the above diets we've spoken about, and it really depends on that person's individual needs and what they're hoping to achieve. One thing we tell patients who are very physically active or engaged in sport is that when you adopt a low-carb diet, especially if you're going from a very high-carb diet, you may potentially notice some short-term reduction in performance. And this can be for a few months even, and this is a process called fat adaptation phase, where basically the body is getting used to burning fat during periods of high performance in a way that it wasn't really used to doing before. And so patients worry about not being able to perform on low carb. The reality is you can. There are many elite athletes out there that are on ketogenic or carnivore diets, so it can be done, but often there's an element of patience that needs to be sustained there while your body adapts to that. And also being very diligent with electrolytes again during this time can be very important. Now, whatever approach you go for, it needs to be treated as a lifestyle, not a diet, because it must be sustainable for you. Your needs may also change over time, so nothing is set in stone, and in fact in different phases of your life a different diet may be appropriate. So for instance, in pregnancy your optimal diet might be a little bit different to what you had before. If you're in a phase of life where you're building muscle, then for instance higher protein tends to be important, so that may be an important consideration. And then there's various disease states. If you happen to be diagnosed with a particular disease that does respond better to a different dietary approach, you may need to change things. The other thing to note is the science is also constantly changing, and so our clinic stays on top of all the latest research and tries to adapt our approach and our protocols to reflect that. So just to reiterate the outreach dates again that we're going to Central West, we'll be in Bathurst on the 18th of October, we'll be in Orange on Monday the 21st of October, and we'll be doing clinics in Dubbo on the 24th and the 25th of October. So if you'd like to come and see us in any of those places, you can call up our clinic to book in. In terms of what to expect if you do book in, we're offering in-person consults with one of our two doctors at these clinics. So a new patient appointment is an hour, and that gives us enough time to really thoroughly go through a patient's history and come up with a plan. We also offer telehealth consults subsequent with ourselves and also with our experienced dietitian and health coach. And for some patients, they need that collaborative team approach. So thank you for your attention. Just to wrap up things, we're located in Castle Hill. We also do telehealth consults nationwide. And we've also got a presence on social media, so you can find us on Facebook and Instagram at Sydney Low Carb Specialist and at Sydney Low Carb. Thank you for your attention, and we look forward to seeing you soon in the Central West.